MLT Case Study Series 19. Topic: Navigating the Complexities of Male Fertility, a Semen Analysis Case Study. Understanding the impact of sperm morphology on conception success. Understanding semen analysis. 1. Volume. Normal range, 1.5 to 5 milliliters per ejaculation. Significance, reflects the functioning of the seminal vesicles and prostate. Low volume may indicate issues with these glands or could be due to retrograde ejaculation. 2. Sperm concentration, count. Normal range, 15 million sperm/ml or more. Significance, indicates the spermatogenesis process's efficiency. Low sperm concentration can be a sign of various conditions, including hormonal imbalances or blockages in the reproductive tract. 3. Motility. Normal range, 40% or more of the sperm should show movement. Significance, assesses the ability of sperm to swim, which is crucial for fertilizing an egg. Low motility can be caused by genetic defects, lifestyle factors, or exposure to certain chemicals. 4. Morphology. Normal range, 4% or more with normal forms. Significance, evaluates the shape of sperm. Abnormal morphology may reduce the ability of sperm to reach and fertilize an egg. 5. Vitality. Normal range, 58% or more live sperm. Significance, measures the percentage of live sperm in the sample, indicating semen's health. 6. pH level. Normal range, 7.2 to 8.0. Significance, the pH level can affect sperm motility and survival. A low pH may indicate a blockage in the ejaculatory ducts. Case study. Patient details. Age, 32 years. History, trying to conceive for 18 months without success. Semen analysis results. Volume, 2.0 milliliters. Sperm concentration, 20 million/ml. Motility, 50%. Morphology, 3% with normal forms. Vitality, 60%. pH level, 7.5. Interpretation. The patient's semen volume, sperm concentration, motility, vitality, and pH level are within normal ranges, indicating good reproductive health in these aspects. However, the morphology result is slightly below the normal threshold, which suggests a potential issue with the sperm's shape. Abnormal morphology can decrease the chances of successful fertilization because the shape of the sperm can influence its ability to penetrate and fertilize the egg. Discussion. For this patient, while most parameters are within normal ranges, the slightly lower percentage of normally shaped sperm morphology may contribute to difficulties in achieving pregnancy. It's important to consider that while abnormal morphology can impact fertility, it's only one aspect of semen quality. In cases like this, medical lab technologists should advise further evaluation and possible lifestyle changes or treatments to improve sperm morphology. This could include advice on diet, avoiding smoking and excessive alcohol consumption, and considering medical treatments if necessary. Conclusion. Medical lab technologists play a crucial role in analyzing and interpreting semen analysis results. Understanding each parameter's significance and how they interplay can help in diagnosing potential fertility issues and guiding patients toward appropriate interventions or treatments. Thank you. Please subscribe for more videos.